Cheers.
Round million. Hi. I would say round.
Cheers. It's not. So welcome to Coffee and
Childbirth.
I'm Dr. Rhee. I'm a chiropractor. I see women and children, and it's where women and children thrive.
Yes. We're trying out her new tagline. It's great. It rolls right off the tongue. I'm Dr. Kelsey. I am a physical therapist by trade, and I see moms and babies in their homes, and also potential daycares if needed. And we're going to talk a little bit today about, we have some tools here. We have Dr. Rhee herself, about Gonstead Chiropractic, but then also however you want to share that.
Okay.
Because that's something that, like in my mind, it's not all the same. And I know you talked about the neuroplasticity, the neurological aspect of it. So I'll ask you some of those things.
Sure.
And then I'll probably ask, like, realistically, if you're talking to a client, like, don't talk to me like I'm a colleague right now. Talk to me like I'm a mom. Because I mean,
you are one, so
because I am one. I may not know those words, and I'm just curious if, like, audience-wise, that's who's watching or listening.
All right.
I
like
so
that.
when you became licensed, you went through all of your stuff. Did you always know you were going to be using the Gonstead method, or did that? Okay.
Absolutely. I got into the Gonstead work first quarter. I was introduced to it, I should say. I was introduced first quarter of school, and then I never left.
Because it was like a club.
It was a club.
You were saying it was like
Yeah. Unfortunately, my school, even though it was known to be like the most scientific and most like evidence-based school, I later learned that my school, which I still think is an awesome school, it's incomplete. Okay. Because in the philosophy or in the principles of chiropractic, there's three, we call it the triad of chiropractic, which is art, science, and philosophy, right?
Okay.
So my school was great on the science.
Yeah.
Horrible in the art of it, and non-existent
in the fucking downhill from there.
And I didn't obviously understand that at the time. And then but I got introduced to those principles in the Gonstead work, and I just was like, why are we not getting all of this in the curriculum of the school that I'm paying a lot of money to be in? So I got introduced to the Gonstead work, and the reason I was so intrigued by it, and I went to like all kinds of clubs, like every club that the first year you're like trying to checking everything out, and the reason I was really, really into it was because I could tell that there was a very well thought out method of the process of doing the actual examination and analysis, but also the actual administration of the adjustments were so specific and calculated. And because I am a recovering type A.
We should go through a whole episode on like, where's recovery?
Where's my recovery? I have relapses and I relapse and stuff. But I just really liked how organized things were, how there was a method behind the clarity in it. And then it made me feel like I could be confident to like actually portray that and communicate that with my patients who know nothing about chiropractic, because it gave me that clarity to be able to do that. Even if I was 20 something years old and starting out,
which is nice to have that as an anchor as you're going out. I feel like I laughed when you were like, I paid so much for my school and all that stuff, because I'm like, what they didn't teach me. I mean, it's kind of wild.
I mean, I get it. You only have so much time,
I guess, but at least from the PT side, you guys probably, as chiropractor, like the care of that probably more was explained on the business side, or
we didn't get any business
fee for service.
We didn't get any of that either,
because we really didn't. So
we're practitioners.
So you have like a method, but it wasn't necessarily, like you said, the art aspect of like talking with a person. Really understanding the psychology of why people make the choices that they make for plan of all of those things, like commitment to things, all of that. I feel like, that was a tricky spot of like, how much did I learn about that on the job?
Experience based for sure.
Yeah. Which is another, I mean, as far as like the experience that you have is another unique part of what you bring to the table, that you have not been doing this for, you know, you're not fresh out of school.
No.
You've had different practices where you have gone from more general practice down into
more conventional way of practicing for sure.
Specific to mom and baby and women and children, right? Versus like the whole family style.
Yep. The Gonstead part was a big part of my schooling. I spent a lot of weeknights and weekends at workshops and seminars and conferences for Gonstead work as well, which was a big argument between my father and I, because he was like, I'm paying you to go to school, and why am I paying you more? Additional.
Right.
Which makes sense, because if there were other schools that taught the Gonstead work as part of the curriculum.
Yeah.
But which meant I would have to leave California to go to those schools.
Which he probably also didn't want either. So he's like, I'd rather just pay for this if you're going to be here.
Yeah, exactly. Yeah. So that was my Gonstead. I mean,
like, sorry, Dad.
Yes. So here we are, but I think that's what helped me be pretty successful right off the bat, because of the clarity that I had. So I really owe my whole career to the Gonstead Society. Obviously, it takes up hard work to get there, but I think having those things laid out and following the protocols, and obviously there's always exceptions to the rule, but for the most part, it gave me so much clarity, which gave me the confidence to be able to do what I do. And even if it was just the basics of the Gonstead work, I think that just gives you so much leeway and tools and understandings to be able to like start off as a starry-eyed 20-something doctor who wants to save the world.
Yeah, you want to treat everyone, you want to help everybody, you want to be able to like, it's so simple to have the protocol that's behind you to support you with that.
Yeah.
When it comes to tools and things that you have for that, working with that client that comes to see you, what do we have here? What are the things that we have?
Yeah.
And tell me more about that.
So before I tell you the tools, I should also tell you then the Gonstead method. The reason it's called the methodology or a system is because there's 5 steps that we have to follow.
Okay.
And the 5 steps of the Gonstead principles is visualization. And then the visualization is when you come in for an exam. It's the way you're walking into my office. It's the way you're going to be, like I observe patients walking down the hall all the time. There's a reason for that. But also when I sit you down on my chair, looking through the skin qualities, there's edema, there's redness, all of those. That's super important. And then the second is the X-ray. So a lot of people think we'll come in and go, oh, but I got X-rays done 2 months ago with my medical doctor. And I go, I'll look at them. So I always want to see more images, more information, the better. But the way we take the images as a Gonstead chiropractor is also different than even a conventional general chiropractor. If you're looking for like a
break in a bone, which would be like the medical piece of it, or like, I have back pain.
Yeah, any lesions or any fractures or growth is more on the medical side of looking at it, which we are also educated in doing. So in school, you would, because I went to a scientific school, we had a whole year of just like conventional radiology, right?
Got it. Okay.
So when you take an X-ray, you are responsible to diagnose everything that's on that image, and if you miss it, then you screwed up. So it's important that people know it's not just, we're not looking at it just with a chiropractic lens. We're also looking at it a medical lens,
and that's part of like scope of practice and what you're Okay.
And then so the Gonstead X-rays are full spine X-ray, front and then side view, and that tells us an understanding of the biomechanics of that patient and the anatomy, and then how that affects the actual adjustment itself.
Okay.
And then the third thing is the instrumentation, which is what I have in front of us here. So my tools look like they're from the 50s.
Well, and to be honest, if I were to use a goniometer, I don't bill insurance anymore.
Yeah.
I haven't used one of those probably in 6 years.
Yeah.
Because what does it really
Was it measuring?
Me?
I know.
I mean, it doesn't. So with the tools that you have, like you said, you've had them
forever.
Longer because they have stood the test of time as 100%. Far as giving you information.
Yes. Okay. So there are newer models of what I have.
Yeah, but if it works, it works.
I like the older models. This is one of the originals. And I think this one's from the 60s or early 70s. But they are just more...
She does
I think
not.
She's done. She's done with us. She's like, I'm uncomfortable. This is like, I'm done.
Asking for a piece of steak. You don't get a piece of steak if you're being sassy.
So this is called a temposcope, but nowadays they're called a nervoscope. Okay. And it's a name of it. But what it does, it actually reads temperature changes paraspinally, which means the temperature on the sides of the spine, right? So the muscles around it. And the reason we look for heat changes, if there's inflammation in the joint, there's going to be heat, there's going to be some pain there's some swelling, all of those things. So this is just one of the things that we use. And now most Gonstead doctors, I would say probably like 90% of the Gonstead doctors use this instrument only. Right?
Got it. Okay, right. So like an actuator, which we won't get into the rights or wrongs of the actuator.
Okay.
Notice how we've done this enough times where I'm like, we're not going to get into that. But so it's like the actuator or the click is a tool that another type of chiropractor would use. Jury's out, depending on who you ask, of whether the accuracy of that.
Are you talking about activator?
Activator?
Yeah. I was like, what is an actuator? Okay, so that's a different kind of tool. That's an adjusting
tool. And then this
is a measuring tool. Okay. Yeah, so this is for information. So this is look for heat changes. It's a temperature sensitive device. And so there's different versions of it. There's like Delta T's, there's like nervoscope, temposcope. There's different kinds. There's many of them. But most Gonstead doctors will use a temperature sensitive device. Newer ones, older ones.
And that's for baby and mom?
No, I don't really. You can use it on a baby, but I just don't think it's as accurate because on a baby, most babies, if they're not really severe, the inflammation is really hard to pick up. And then they wiggle a lot.
Yeah, again, the accuracy.
It's like the accuracy part. So this one doesn't have good contact sometimes. So I used to use it on every baby, but then I think it's more accurate to use something called an ECS, which is for the baby. Okay. I use it on adults and everybody, but the
across
babies,
the spectrum.
Yes. Okay. But for the babies, I think this is way more accurate. Okay. So ECS stands for electrical conductivity scanner. Okay. So we all know that our human body is functions based on electrical impulses or conductivity between one neuron to another neuron. Yep. And so this it's not a grounding probe, but it gives us a way for that electrical currency to rotate through the body.
Right, so it completes
it. Yeah.
Or whatever.
So you can kind of call it as a grounding. Okay. But so you hold on to this, and then this goes on to the back of the patient. Okay.
And I've seen you use both of these.
And then this is the sensitivity and voltage dials. Okay. And it's a battery operated device. Okay. And then it'll have a currency going. And if there's an irritation to that nerve tissue, then it's going to give me a certain type of reading. Okay. It'll just go out of whack, if it's really bad. Okay. So this, I think, is way more accurate to use, especially on a baby, especially like newborn. They're so tiny. Yeah. And we want to be as accurate as possible. And so I run this, and it gives me ability to understand where that neurology is. Okay. And then, unfortunately, I wish we had better curriculum on the ECS. Okay. We just don't. There's not a lot of people that use it or know how to use it well enough. As far as
like research to say this is
not so much the research, but the actual users that can teach it.
Got it.
Right. Okay. So like there's already a very small number of people, or a small number of doctors that know how to use it. Right. And those doctors are going to want to practice. Right. They're not going to go to a school
clinical
to teach
teaching.
it. Okay. Yes.
Okay. Academics.
Correct.
Got it.
And I'm just really, really lucky because of my mentor, Dr. Lori and Dr. Pete O'Hara. Dr. Pete O'Hara is one of the doctors that actually developed this device. Okay. So we do have a newer version of it. It's not as sensitive. Okay. So that's the reason why I love the old stuff, because they're much more sensitive than the newer ones. Okay. So that's the instrumentation. I mean, I have a few more, but I'm not going to go into that.
And so these two things are to gather information. And then you are deciding, or you are then using that for the adjustment, which is hands-on.
Not yet. So this is just part. So now we got visualization, x-rays, right? The Gonstead x-rays, instrumentation, and the last two is going to be the static palpation and motion palpation. Okay. So the static palpation is kind of like when I'm pushing onto those joints. Okay. Right, the bones in the joints. Yep. That tells me if there's any, like, if it incites any kind of pain to that patient, or if there's any squishiness or edema. Yeah. And that tells me, okay, where that level is too. So this is one aspect. Okay. Now I know there's some more inflammation. And then also motion palpation, which is the last thing that we do, is looking for the quality of movement for that joint. Okay. So, you know, for a full functioning joint, it should move in all direction for that mechanic, without inciting any kind of pain or discomfort, and should have full range of motion. And we check it every single joint. Yep. Okay. So then with all of those in place, then we go, okay, this is probably where the subluxation is. And that's the subluxation is the word that we use to find the actual joint restriction that causes neurological irritation. Okay. Then that neurological irritation is associated with whatever complaint, if a patient has a complaint. Okay. Right. So because I practice in a more neurological base too, I really want to look at the autonomic nervous system and how that affects their symptoms. So if they're complaining of like constipation, then I will look at the spine a little bit differently than someone who's saying, oh no, I have diarrhea, I've been having diarrhea. Yeah. Then I will look at the spine according to that. So symptomology, but most of my patients who've been with me for more than like 6 months, they go into like just maintaining their adjustments. Yeah. And then there will be days where they're like, oh yeah, I didn't feel so good this week. Sure. Or like I drove like 9 hours. Road trip or something with my screaming child or whatever it is. Yeah. Yeah. Okay, so that is a lot of information. So so with all of that, like that's more interesting to me as a clinician. But would you, as a mom, if I put my mom hat on, like would that have, like, how would you have distilled that down, or would you kind of just disperse it throughout your session? Because the first evals would be, or the first eval would be longer than your typical, like come in for your adjustment, leave. So that discovery call that you do also. Yes. So I have that conversation with them, but very short. Yeah. Right. Like I'll tell them, like, I want you to look into the Gonstead work. I'm a Gonstead practitioner. I'm the only diplomat actually in the whole state of Nevada as well. So we have tiers of the status, I guess, in the Gonstead work. There's fellows and then diplomats and members. Okay, got it. So I'm still debating if I want to go to fellow or not. When you transition, well, maybe when I retire. Yeah. But I think the way I speak to my moms, I just talk about there are different kinds of chiropractic out there. Oh, so I'll give you an example. I have a patient that just reached out to me from it's a patient from LA. Okay. And she had a very difficult time getting pregnant in the beginning, and then at the end of my time in LA, she ended up getting pregnant, and then she just loved the Gonstead work. She knows all about Webster as well. And then she moved away, kind of very similar time as like when I was closing down. So I haven't spoken to her in a while. Yeah. And then I did refer her to a good fellow Gonstead diplomat doctor in Minnesota. Okay. But she ended up retiring. Okay. So then she's like, she messaged me a couple of days ago and she was like, Dr. Rhee, what do I do? Because I want to get Gonstead, but I also want to get Webster. But I hear the new Gonstead doctors don't do Webster. So is it better? Oh, interesting. Yeah, not all Gonstead doctors are Webster certified. Right. We were going to talk about this in the future. Or pediatric certified either. We were going to talk about this in a future one. Yeah. Webster specifically. Yes. Okay. So then she was like, kind of then she's like, what do I do? So she's like, Dr. Rhee, you tell me, should I go to a general chiropractor who does Webster because she's pregnant now? Or do I go to a Gonstead doctor who doesn't do Webster? And I was like, oh, I don't think I've ever had that question because I've always done both.
Well, and that's interesting to me. I feel like you would do that as a Gonstead practitioner if you're seeing pregnant people.
Well, if you are, right? So, but then
there's just not as many.
But there are Gonstead doctors who are just general practices or family practices, so they're not Webster certified, right?
Yeah.
They're family doctors, but they're not like actually specializing in like they can adjust a pregnant person, but to do what I do outside of just getting them adjusted is very different.
Yeah.
So people think, oh,
it's always so interesting to me to think because I'm like, how would you see everybody like that? I feel like I've been.
It's hard
in that specialty for long enough to feel like
that's what I said to her, and I said, look, ultimately it's your decision what you want to do, and so what she did. I got a message this morning from her, and she said, I contacted this general chiropractor because she does Webster and she sees a lot of pregnant moms. It's like, great. What did you find out? And then she gave me a list of 50 things that she does, apparently. 50 like techniques and tools that she does, right?
Okay.
And then also Webster, right?
Okay.
So she like literally copied and pasted it to me.
Yeah.
And I said, okay, that sounds like a general chiropractor. Who is trying to just do everything under the sun.
Yeah.
So she's going to be just kind of good at, it's like a sprinkle of information everywhere.
Jack of all trades.
Yes,
it's not the depth, like the bench that you have is not as deep.
Correct. Okay. So I said, she's going to make you feel good probably. Like in some way or another, it'll feel good probably. But to do actual corrective work, she probably won't be able to do that.
Yeah.
And then I said in school, because it's a general, like in chiropractic school, you have to, they kind of introduce you to so many different things, right? For a reason.
Yeah.
So most chiropractors who don't do anything outside of that curriculum, that's how they practice. Right. They'll do a little bit of everything.
Same with PT, where it's like you graduate being like a general practitioner. You're not going to hurt somebody by being generally, but you're also not going to get the result, in my opinion, the results that you're wanting. Like, you know, don't sign me up to work with a NFL player. I'll work with their wife and their child, but not that person, because I'm not going to be able to, I'm not going to hurt them, but I'm not going to give them the gains. And also, to be honest, I don't want to listen to them because they're going to be whiny. But it's like, that is just not the arena that we would be in. Okay, so when it comes to, like you were saying, in that situation where it's like the specialty of what you're doing, also the experience that you have just with that population, what do you feel like, so I was talking about kind of like the taper concept, or frequencies are very different for each person. What do you, if a mom is coming to you and they're like, okay, I'm in for what you're talking about. I believe that you're really good at what you do. I've seen the reviews. I've talked to someone in real life that I know that has seen you. But like, there's a lot going on. I have multiple kids. Can I see you weekly? What do you suggest? What if I can't see you more than once a week? So what is that conversation? So like? I think that's the reality.
Oh yeah. I mean, I had that today. I had a postpartum mom that I was taking care of her during pregnancy, and she's got now 4 kids. She was on her 4th.
So many.
And so she's like, I can only manage once a week.
Yeah.
And she's coming in for a very specific condition that she's been trying everything under the sun to work on. She tried so many different things over time, and it wasn't helping her. And she found me somehow during pregnancy. And I said, look, I'm going to help you feel good right now, but to really correct it, this is probably going to come back once you're not pregnant anymore. And in order to do that, I have to do a full comprehensive exam, which is including the x-ray. So she came in, she came in today, and she was
devoted that time.
And then she did the whole thing. She was so excited to see what was wrong with it. She had a bad injury like 2013. Showed her the x-ray and said, this is what's happening. And then she was like, I'm committed, but I can only manage once a week. And I said, look,
committed at a certain level.
You just have to know, it's like management of expectations. You just have to know, if I see you once a week, we're not going to get the result in a timely manner.
Right. It's going to be a different.
It's going to be
trajectory.
Correct.
And that's okay as long as you're aware of
exactly.
that.
And so ideally for me, I used to, when I was even less experienced, when I was younger, I used to see them 3 times a week, about probably anywhere from 2 to 3 weeks in the beginning. Because I felt like I needed to see them more often to be understanding of what's happening.
What's the stimulus?
Yes.
You're doing the treatment, what's coming out of that.
Correct. I needed to know it. So I used to do that. But now I think with my experience and like the amount of the ability, my skillfulness of my adjustments, they're much more exact and accurate. They're more powerful than what I used to be able to do when I was like 30 years old, right?
1,000%.
Yes.
You're more efficient and accurate.
Correct.
And also your questions that you may be asking in between those times, if they're like, I'm freaking out today, you may have a better read on that.
Yeah.
Okay.
So I now see them twice a week to start. And I usually like to see them about twice a week, a good 3 months, like 25 visits in.
Okay.
And then I do a post x-ray to see if there's any actual changes of their anatomy, the curvature and all of that. And then after that, it's about once a week for a couple of weeks to test to see if they're holding their adjustment. And I push it out to every 2 weeks.
Yeah. Holding the
adjustment,
holding the muscle coordination. Yeah. So like yours is the adjustment, mine is like
the
muscle coordination.
That's when I go, hold and you need to go see Dr. Kelsey.
Right. It's like,
or do some kind of exercise, or
just try out like
move
what you
your body.
Trying to go back to. Like what is and that is a really comforting, realistic response. Because I think sometimes when it comes to specialists, and this is what I hear a lot, because I'm like we said, I don't call myself Dr. Daniels because I feel like I would be looking for who that is, as someone said it to me. But it's like a lot of specialists are not as understanding and aware of the reality of life. Yeah. And I think that can really throw somebody off if they're trying. It's like the second that they actually try to start making some headway, they're not even given a kudos or a small win, and then they're like, well shit, now what am I supposed to do? And so then you so I think that I'm a little protective of my clients in that way sometimes, where I'm like, I don't want to serve you up to somebody who's just going to be like, this is my training, this is my reputation and my level, blah blah blah, and then they have a mom who's really moved heaven and earth, they feel like, to get there, and then they're just like slashed. Like, I am a little protective in like who I see. So I think that's something, or who I refer them to, even if I'm like, it's great. Yeah. It is great that this person is amazing. Yeah. So that's awesome that you feel you can do that. And I've heard that from clients from me before, of like, it's a breath of fresh air to work with people who really get that there's always time. Yeah. Where ideally we're going to be here. Yeah. It's only a rush if you feel like it's a rush. You have to know that changes over time.
I think that's the biggest thing, like just trying to manage patients' like expectations about it, because they think sometimes patients will be like, oh, if we do this and this, okay, my problems are solved. Well, sometimes it takes more than just that. Yeah. Right. It really depends.
Takes less, and sometimes it takes like an unorthodox approach. And sometimes it takes someone, like you said, you're trying everything under the sun, and maybe those things that you tried to, we didn't try long enough. So we're going to have to actually try this longer than you think, because everything else that you have tried has not been like given a chance.
I'll tell you this too, because most chiropractors practice generally, that kind of gives us a little bit of a bad reputation sometimes too.
Oh, sure.
Right.
Same on our end. Where people are like, oh, a PT.
Like he didn't care. Yeah. Like, what is that? Oh, you just slap me on some exercise or something. Right.
Yeah,
same thing with chiropractors. Right. Yeah. But then there are, I would say probably 70%, give or take, general chiropractors. And then I would say probably like 30% of the chiropractors in the whole profession have some sort of specialty. Right. So like Gonstead is one of them. Right. I do also love NUCA. NUCA is the total opposite.
I've never heard. Yeah. I don't think I've ever heard of
NUCA. Yeah. So NUCA, or upper cervical specialist.
Like
yeah, so they actually, so Gonstead and Nuka would be probably on the opposite spectrum of specialties of chiropractic techniques. So Nuka is, they very much, I had a good friend of mine, Dr. Giancarlo, practices down the street from me in Pasadena, and he was like a super nerd when it comes to like brain and brain stem. So Nuka is a non-contact, I think it was, or non, yeah, there's a word for it that they do, the way they describe it. So it's a like a tonal work. So only in the upper cervical. So occiput, C1 and C2. And it's very precise. They take, I think, like 15 x-rays of just like your head and your neck, right? And to see exactly what it's doing. Because even in Gonstead, even though our work is based on we call it the foundational principles, which is the pelvis and how the pelvis dictates the foundation for the rest of the spine. Where Nuka says the foundation starts at the top.
Got it.
Right? We have like in chiropractic, we have a philosophy called an ADIO, which is above, down, inside out. Meaning above the brain, and then it sends the signal down the spine, and then everything gets expressed from the inside the body and outwardly. So into the organs and stuff. So the ADIO is a big principle when it comes to chiropractic or philosophy. Nuka is fantastic for the fact that patients who have a lot of head stuff going on.
Like migraines.
I mean, I can treat all those things too, but if I had a patient who had all kinds of crazy stuff, like strokes to...
That's what I was just thinking.
Just like all kinds of weird... all kinds of weird, like layers of head symptoms, right? Like...
Or even coordination.
Palsy to coordination and... Or even like... And this isn't like just one condition. I'm talking like layers of conditions. If those patients come to me and I've done everything in my power to get them balanced and they're still having residual problems that I can't, then I would refer them to Nuka, right? So we had a great, like if he had a patient who just couldn't get the sciatica problem resolved, he would be like, go see Dr. Rhee. So we had a great...
Like, I could see prenatally potentially where it's like they don't necessarily have all of those layered things.
Correct.
That's so interesting. Wow.
So hi, Dr. Giancarlo.
Yeah, we have a lot of people we got to tag in these. We should go back and be like, tag.
Yeah.
Well, thank you for explaining that. And then like, you know, just the concept, I think too, like we were saying, of being like ready to embark on something. That's something I think that's really unique about you're very ready to explain that to somebody. Like that, someone who's looking for that comprehensive piece is definitely someone that I refer to often for you. But I think sometimes it's like they don't even know that they're looking for that. No. So sometimes that's also the true part, right?
Well, I mean, even with my longtime patients, right, who've been with me forever.
Sure.
I'm like, oh, you didn't get it. Like you've been with me for 10 years.
Yeah.
Oh, you didn't get it. Okay, we'll just start over again.
I've
had that conversation.
That's fine. Because that's what we are passionate about. And so we're happy to
100%.
have that. Like we can't stop talking about it.
No.
So
I mean, I can have like hours on this topic. Hours.
So obviously if someone is watching or, you know, listening and they're like, I haven't necessarily seen this type of approach before, that would be you would be the person to talk to in Vegas, or even if you know kind of the network too. So even if they see it elsewhere and they're not here, it's like you probably know of where they could go. So thank you so much for your time.
Thank you for asking.
Out of time right now.
Yes.
But we will see you next time for the next topic.
Yep.
Thank you.
Thank you. Cheers again.
Cheers.
Have a great Labor Day weekend, even though it probably won't be.
Whatever holiday is around.